everyone. Today mainly we are going to have a look at the introduction to the podiatry, okay, and how you can use this in your regular practice. So has everyone is joined, right? We don't have to wait for anyone.
Yes, ma'am, you can start now.
Okay, now since this pandemic, it has shaken up all world, okay, and our physiotherapy profession is also, it's hampered our regular practice. And now everyone is looking up for what else they can do to generate extra revenue. The footfall is reduced at the clinic, okay, and considering our field is such that we have to come in close contact with the patient, the footfall is going to be significantly reduced at least for next few months. So including our regular practice, how we can work on something more revenue. But okay, so everyone is looking for the new resources, and but yeah, it should require low investment also, because no one want to invest more money now. Rather, almost if you will get something with no investment, and still it should be profitable, and it should be less time taking and demand minimum space, and rather adjust in your current existing setup. And what kind of support you will get through this. Okay. So I have made a very short PPT, so you will get an idea about how this practice works and all. And so you'll get a brief idea about the podiatry practice. And in the end, we'll have a question and answer time. So you will put your all queries in the chat box and I will answer those. Okay, so if you want to include your podiatry practice in your existing clinic, we are here to, give a complete support for that. Now, how that will work. Now, before that, first we'll have a quick look about how is the podiatry works. Now, everyone knows that podiatry is the science. It's mainly deals with the foot and ankle related problems, particularly lower limb. So mainly it deals with the diagnosis, treatment of foot, ankle, and lower limb related problems. And it's called as a podiatry. Now, podiatry has been practiced since early 19th century in America, Australia, and Europe. But particularly in India, there's very less awareness about this field. Now, foot is base of our body, and if that is altered, the altered alignment, it affects your entire posture. This image, okay, it will give a very clear idea about, some minor problem or either of the foot, how it can affect the entire posture. So this is the right posture. You see our pelvis is at same level, our shoulder level is at the same level, and knee is equal. Everything is perfect. Now, suppose because of any reason, if one side arch is collapsed, or we also say if it results in pronation. Okay, second, there is, okay. So everything is perfect. Now, if there is any on one side, that will lower that side of the knee level also. That will result in drop of the pelvis on that side. Obviously, then it will impact your spine, which will lead to scoliosis, and it will affect your shoulder level. So one small problem in the foot will have a big impact on your entire posture and knee. And you can imagine if that person is having this problem since childhood or from the young age, by the time that person reaches to 40, 50, 60, what kind of clinical orthopedic issues it will lead. Okay. So 3 out of 4 people experience serious foot complication in their lifetime. And most of the time it is neglected. Neglected in the sense, mainly there's a lack of awareness, not just in general population, but even in the medical population. Being a physio, we closely deal with the patient's mobility. If patient has any discomfort regarding walking and all, the first person the patient will approach is the physio. Okay, so we closely deal with the patient's daily mobility factor. Now, these are the few common conditions which we see on daily practice. Okay, flat feet is one of it. Plantar fasciitis, calcaneus spur. These two are, you can say, the most commonly seen conditions, and most of the time, it's like we never able to achieve the full, 100% pain relief in that, no matter how much we try. Okay. The third is Achilles tendinitis, retrocalcaneal spur, recurrent ankle sprain, patellofemoral pain, IT band syndrome, osteoarthritis of the knee, recurrent back pain, corn and calluses. Okay, now these all conditions we also claim it as a, things which keeps on coming back. The heel pain, you manage with the regular modalities or stretches, patient feels better, and after a few months you'll see okay, patient is like okay, there's not complete relief, some pain is gone or but it is still there. Achilles tendinitis or say IT band, patellofemoral, these all are condition, they keeps coming back, coming back. So what is the reason why they coming back? Back pain in general, yeah, we treat back pain patients with our regular core stability exercises, posture corrections and all. But even in practice, we can get a patient who are doing your prescribed exercises regularly, but still the pain is reoccurring. And you are not able to understand why it is happening when the patient is also regular with the all exercises. So being in podiatry, what we are going to learn is before starting the treatment, it is very essential to identify the root cause, okay, which can be only known after a thorough assessment. Okay, so that is why the assessment in podiatry is very much important. Now, how this assessment goes. So I'm giving a quick review how the podiatry assessment goes. Okay, so when any patient visiting with like above mentioned the complaints, you have to understand what is the patient complaints and what is the lifestyle. Lifestyle in that you're going to really study keenly what are the aggravating factors, how much is the patient's daily routine, walking, standing includes, and how is the pain affected by that. Visual inspection of the feet, foot alignment and posture. Now, these are just headings, and there are lots of subheadings come under that whenever we are talking about the foot alignment and all. Okay, so these are just, I'm giving you gross idea about the assessment. Then gait analysis, foot sensation, particularly if the patient is diabetic or having a neuropathy, it can be non-diabetic also. Measurement of the foot size. Now, this image which shows this device is called as a Brannock device. And on that scale, when we measure foot, we are going to measure the foot length as well as the foot width. Now, this is something most of the people are unaware that when you're buying shoes, we have to consider your foot length and width as well, because most of the shops, they only have a scale which measures only foot length, but someone can have a very broad feet or the feet with a bunion and all. So these deformities makes wearing any sort of closed shoes becomes very difficult. That's why measurement of the foot size, length as well as width is important. Inspection of the patient's footwear particularly which he has used a lot, because that old footwear, the wear out of that footwear will give you lots of clue about how is the patient's walking pattern. Okay. Now on this, mainly I am going to give you a 4-point quick screening to identify the patient. Okay, now you have a patient with whatever above complaints, back pain, heel pain, whatsoever. Now, how to judge whether that patient will need an orthotic correction or he will get a benefit with the orthotic correction. Okay, so I'm giving you 4 quick points. So in like just 2 minutes, you can screen that patient if he has any existing foot elements which is causing trouble. Okay, first is easiest thing, that is the observe his toes, toe deviation. We see you all are physios and the occupational therapist also. We are all aware of these deformities, like say bunion hair, hallux valgus hair is the first thing. Second is called as a banana feet, where the great toe is in adduction. Clawing of the toes, which very closely suggests there is some balance issues. Okay, so this is the first point. Second, then observe the inner side of the foot. Okay, so where you are going to observe the medial arch. So whether that arch looks normal, whether it's very high arch, and whether it's completely flat feet. This is the second point. Okay. Now many times a person might not have completely collapsed arches, or he might not have very normal arch also, but his arch might be reduced a little. Then lots of physios, like physios who has attended our workshop before, they get confused whether it's pronated or supinated. So in that case, you observe the back side of the heel. Okay, that is your posterior view calcaneus, and turning of the heel. Okay, so where you see whether calcaneum is inverted or everted. And accordingly, you can categorize that patient as whether he is a pronated, is neutral, or is in supination. So this is the third point. And fourth point is calluses, con and calluses. Calluses occurs due to undue pressure coming over certain areas of our foot, and long-standing calluses often turns into cons. Okay, now in general, in our practice, you will not get patient with the complaints of con and calluses. Okay, but the person's foot alignment, like suppose if someone is having flat feet, there will be lots of forefoot pressure, and there you will be able to see this calluses on the forefoot, particularly the great toe and the first metatarsal head. Okay, so this calluses also gives you idea about how is that person's walking pattern. Some people, like female patients particularly, if they are using lots of high heels, they will have a lots of calluses under forefoot. Okay, so these are the quick 4 points. I will just revise it. Okay, first was observe the toes, and there is in toe deviation. Second point was medial arch. Second was to observe the calcaneus bone, and fourth is con and calluses. Okay, so this is just a quick screening to judge if patient is having any sort of issue. Now, as you're noted this assessment. Now, this is something you can start immediately implementing in your practice if you are having any existing patients or new patients coming for the therapy. Just quickly you screen this and you will get an idea what is the percentage of this problem in general population. So in like very second, third slide, I mentioned 3 out of 4 people has this problem, and that's actually true. And you will see this problem very common. You'll see this toe deviation and deformities very common. In fact, most of the workshop we conduct for the physio and in practical sessions, when we tell them, start evaluating each other's feet, and almost 70 or 80% of the physios, they have some sort of foot problem, and many of them have like really complete flat feet, serious kind of foot problem also. So you can imagine even a healthcare professional has this problem, but we don't know exactly what to about it. And particularly our profession, which demands of lots of standing and walking around. Also, if you're having any patient who are coming back with back pain patient, they're coming to you again and again, they're doing exercises, but the back pain is reoccurring, evaluate their feet, okay? Observe their toes, observe their arch, and then you will come to know whether those symptoms are related to their feet. Okay. Now, if you have already patient and you did that 4-point screening of the patient, now what? Okay. Now here all the catch is, because as a physio, of course, we are aware of how to do the assessment or kinesiology, biomechanics and all. But once it is done, do you have any solution to give them? Okay. So the solution which should come handy. Okay. So here in general, what I prescribe is these are bio-advanced prefabricated orthotics. Okay. I'm just giving you a rough idea about this insoles, because on PowerPoint or on video, it's very difficult to judge what it is unless and until you see that product, or particularly when you stand on the insoles and you get a feel about how that orthotics, puts impact on your posture. So this bio-advanced orthotics, it comes in high density. That's the most hardest form. Then it's a medium density, slightly lower than, and the low density. These are called the full length insole. Then there are various types of them. There is a half length insole, or there is biofashion. But these three are the main insoles which we use in our regular practice. These are heat moldable because when you see the prefabricated insole, the main query in any physios, the main query will come in your mind is how to customize it. So these are heat moldable, so it can be customized exactly on the spot and very quickly. Wedges. So these insoles, it comes with the complementary pack, okay, which will have a various wedges. We called it as a forefoot varus, valgus, heel raise, and cushion. Pack doesn't include metatarsal bar that comes as a extra, means this person has to purchase extra of it. So these patches makes the customization very handy. Again, it's very difficult to explain on the video. So this will be included in a workshop, practicals also. So lots of people are joining now also, almost a few slides are done. Okay, so these are the corrective wedges through which we customize, and there is a heel raise also. So there are patients with the leg length discrepancy and all. Again, the leg length discrepancy, it's not necessary the person will have a 2 or 3 centimeter difference like a polio patients or some post-fracture cases. Person can have a few millimeter or about a 1 centimeter difference also, but that might be putting a lots of stress on their back and all. So this pack comes with 5 heel raise also, so which you can easily add in the insoles. Okay. So here we're going to study 2 cases. I have included 2 cases. One is the plantar fasciitis, which is mostly common seen problem. And there is a one more case with the ankle pain. I'll come tell you the diagnosis also. So mainly these case studies are to tell you, how the basically effect of this therapy. So the first case is she's a 36-year-old female housewife. She had complaints of heel pain, right side more than the left side. Okay, she had basically heel pain on the both sides before. It's difficult to step down mostly in the morning while getting up. So typical plantar fasciitis pain when the person gets more pain in the morning. First few steps are very painful. The person has to limp and eventually it gets better. Or then later on when they walk more, it aggravates. So it's typical of the plantar fasciitis complaints. She also had a calf and knee pain more on the left side, and she had a low back pain also. But as if now the main priority is the heel pain. Okay, so here is the assessment. There was overproduction on the both sides. Now, particularly for the right side, there was a slightly toe curling was also there. These are the calluses pattern, the calluses at the great toe, the metatarsal head. Again, the left side, there were 2 calluses. You can see there was a difference in knee level. Okay, so in each patient what we visit, we always take their knee level also. So we can comment about if there is any leg length discrepancy. So left knee is significantly, left knee is significantly lower than the right. So it can be kind of LLD case also. The X-ray shows the spur. Now spur, particularly I have included X-ray is, there are many people who feel, okay, abhi to spur develop ho gaya, what we can do about it? Obviously, we can't do anything so that spur will disappear, but we can always work on the pain. So even if the spur is developed, if the right orthotic correction is advised, so patient is advised for the rest and cold pack initially. That is must for every patient with the plantar fasciitis. Because everyday standing and walking, that will keep on aggravating their pain. Now, for the orthotic correction, considering the patient was housewife, she will not be using the footwear at home, sports shoes I mean. So she was advised for the Strive orthotic footwear. I have not included this in the PPT. So this has a orthotic footwear which has an inbuilt arch support. So that was given to the patient, and she was advised for schedule to use of orthotic footwear. Means for any patient, it takes few days to get used to the footwear. So they're advised to wear it for short duration and gradually increase it. So that's what advised, and she was called for the follow-up after 2 weeks. And in 2 weeks, her 90% pain was relieved. And now that is the main thing. But surprisingly, she also posted that her back pain and knee discomfort is also substantially reduced. Okay. So that kind of result, even when the spur is developed within 2 or 3 weeks of time, you can get pain relief. Now, second case, this is very interesting case, and we will be having lots of photographs and videos also about that patient. Okay, she was 41-year-old female, complaints of pain and swelling at navicular, at inner side of the left ankle since 3 months. Okay, now inner side of the ankle means particularly navicular area. Though because it's a video, I won't be able to raise the questions. What is the possible diagnosis you will feel in it? But just try to keep on guessing the diagnosis of the patient. Now, pain is increased gradually in 3 months, and initially it used to hurt on prolonged standing and walking, but now she is not able to walk even few steps. Pain was like really bad. Like on examination, there was a swelling present around left navicular area, and there was a grade 3 tenderness at navicular area. Now, these are the photographs. Okay, so you see the medial arch. It's flat bilaterally, particularly more on the left side. Remember that patient's pain complaints are on the left side. Now, transverse arch, when that is reduced bilaterally. Subtalar joint, overpronation. Obviously, it's a flat feet, so it's overpronating bilaterally, again left greater than right. There is a navicular drop present bilaterally, again left greater than right. Navicular drift is also present. You can see the flat feet, it's like a kind of grade 2 flat feet is there. Calcaneus, it's in eversion, okay, and knees in valgus. Now, this is what is the left foot and the right foot. You see the arch is flattened on the both sides, but particularly for the left side, there is a significant swelling. So this swelling, the tenderness around this area, it suggests of the diagnosis of tibialis posterior tendinopathy. Okay, or we also call it as a PTTD. So she is having tibialis posterior tendon dysfunction. Now, most of the patients with the flat feet, the tibialis posterior is the main muscle which support our medial arch. Okay, so most of the patients with the flat feet, their tibialis posterior is already in very weak, and any sort of minor trauma, jump or walking on uneven surface, or sometime at the gym also they do lots of different functional activity, and the slight strain on the ankle, and their tibialis posterior can get damaged really badly because it is already weak. Okay, now these are the videos. Day 1. Okay, I'll keep playing this video for a while so you can observe how is the walking pattern, how is the limb, okay, what is the severity of the patient, severity of the pain patient. Look at her left hand. The weight bearing on the left foot is so unbearable for her that she's holding her left hand. It's like she's just not able to walk even few steps properly. So she has flat feet on the both sides. Now left side, because tibialis posterior is damaged, she is limping badly. So this was the day 1 video. Okay. Now let's say follow up. So next few slides, I have mentioned what is the how she was treated and how she was advised, but we'll just see the follow up. Now follow up video. Limp is barely there, it's significantly reduced. It is still there, it's maybe like 20% of what it was. There is no pain at all, but okay, so in the follow-up, the swelling was completely gone. pain was reduced by 80 to 90% almost, and she's able to walk bare feet also properly. I'm giving you a minute, so you just keep her, observe her gait. Okay, now then now. Again, this the first video is the same which we saw in the previous slide. Okay, now the same patient, how she will walk with the proper sport shoes and insoles. That minimal limp which was there when she was bare feet, that is gone. Look at her walking speed. Right? So in just 15 days, the patient who was really limping badly, okay, in the follow-up visit, even bare feet, she was much better. But with the sport shoes and proper orthotics, she is walking like nobody will be able to even make out that she has any problem. Now, this patient particularly, she had visited, of course, orthopedic surgeon, and she had visited physio also. And the physio had told her that she has severe kind of flat feet, and this is something she will have to live with it. And when doc patient was telling me, she had like literally cried because the physio told her that, you know, probably the physio thought, okay, the flat feet is not curable. Of course, flat feet is like at this age, it's not curable where she will develop her foot arch again, but appropriate use of shoes and orthotics, she should be able to walk properly. Okay, so how this patient was treated? She was advised for the rest and cold pack. Okay, obviously the pain and swelling was so bad. She was advised for the rest, and again she was advised for the footwear for the homewear. But the sport shoes which she was using were very flimsy at the ankles. So the sport shoes should have a good grip also. Many of the people, you know, they are not aware about if they have already existing flat feet, what type of shoes they should wear, and they start their gymming or the physical activity. Uh, if they get any pain, immediately they feel like, okay, walking to abhi shuru kiya hai, this is just soreness and all, it will go. But they keep walking with their wrong type of shoes, and the damage keeps on happening, and eventually they get this sort of tibialis posterior tendinitis, or say heel pain or knee pain. Like, and then they start looking for, you know, why this is happening. Then they visit physio and all. So she was advised for, you know, a right type of the sports shoes also. So again, she was called for the follow-up after 2 weeks. We usually call patient for the follow-up after 2 weeks. Why is because 1 week is something that anyways they need to get used to the correction. If the lady is, she was 40-year-old female, she's childhood, she has flat feet. And now when we are trying to correct flat feet with the insoles and all, her body will need some time to get used to it. So 1 week is they're getting used to time where they will start using the footwear or corrective insoles gradually. And once they are completely comfortable with it, they can use it throughout the day. So at least minimum 2 weeks of time, you will need to see the result. It's not like, you know, aaj insole diya and tomorrow the patient will be absolutely fine. That will some immediate relief can happen, but not in every case you will get that like a magical result. And the follow-up, the patient's 90% pain was relieved, swelling was gone. She has got a new sport shoes and given in orthotic in that shoes, and we saw the video with shoes and insoles together. Okay, now the pain is gone in 15 days. So now she is good to go with the exercise program. So in general, what we promote is the orthotics is not going to work alone. It has to be combination of the insoles, podiatry, or physiotherapy. Okay, so it is not like this is done, the patient will not need to do the exercises. Patient has to do on their whatever muscular imbalance that we have to work on. So being a physio, if you are able to advise patient both, okay, where you're taking care of their flat feet or alignment issue, and plus we are advising you are able to correct their muscular imbalance also. So this is the best combination, and it can give like really magical results and very quick results you get. Now this is, I have not included this case study in detail, but it's just a patient with the multiple cons. Now again, I say repeat, in general in our regular practice, you will not get patient that, physio that I have a con, okay? But there are many people who are suffering with this element, and particularly if someone is promoting their practice as a foot specialist and podiatrist, then you can end up with lots of inquiries, patients who are suffering with the con, who has tried surgeries, corn caps and all, and this still their corn is not healing. So even when we treat those patients with correcting their foot alignment, and we prescribe corrective insoles, you can get really good result. Okay, so you can compare the pictures of day one, then after a month, after 2 months, after 3 months. Okay, so this is, I just wanted to include an image to show that even this can be treated. Okay. Now, in general, when we are talking about the podiatry practice, there are many companies who promote their expensive foot scanning machine and all. The investment which involves around 3 to 5 lakhs. Okay, and which is definitely, everyone will not be able to put that kind of money into the practice. So advantages of this practice is this doesn't require investment. Okay, and investment means whatever, it's like a foot scale. Okay, the foot scale I have mentioned in earlier slide, foot scale which measures the length as well as width also. So that is hardly 6-7 thousand, and that is up to the physio whether he want to spend it. Many of physios who has attended our workshop before, they when they start practicing, initially they measure foot length actually with the tape or regular measurement scale, and they send us, okay, this is what is the patient's foot length, 21 centimeter, width is 10 centimeter. Then we had given their conversion chart also, and accordingly we see, what is the patient foot size. So that is actually up to the physio, even that is if they want to put it, invest or not. So time, these are the bedside orthotics. So prefabricated orthotics are also called as a bedside orthotics, and they are very time saving because quickly you can give it to the patient. Okay, it's not like aaj ye liya, mold liya, shape ko, measurement liya, then you have sent for the making, and then you call them after. Now once you got the insole, now you don't know whether it is made properly, whether it's done properly. Second is it comes with the self-adhesive patches, and it makes it very simple for the follow-up modification. So the patches are like in the follow-up, you can add the insole in the insole. If there's anything in the future, the patch is not suiting, you can even remove it. So it makes it very easy to do any sort of modifications in the follow-up. This is heat moldable. So whatever we called it as a custom made, we can customize it on the spot, the heat molding technique, which is very simple. You can start in your current setup. You don't need anything extra in this. And revenue, it add-on skills in your clinical practice, and it has hence boost your revenue. And obviously it's a result oriented. You saw the cases. So what results you'll get is like really. Now this is some comparison of prefabricated orthotics. Actually the thing which we had discussed in the previous slide, prefabricated doesn't require more of the financial investment. Custom made, you will need like a really high investment, which will involve maybe up to 5 lakhs. You will have to some orthotician who can, cast the insole and all. Okay, but in prefabricated, by yourself, you can do everything. You don't have to hire any orthotician. Bedside orthotics, custom made are time consuming. Prefabricated are heat moldable. Custom made, okay, if they have to customize it once it is made, and if you want to do any modification, it has a different layers, so you have to really remove the first layer and do the modification. It's a very complicated thing. Okay, again the self-adhesive patches makes it very easy for the follow-up modifications. Now, prefabricated, all aspects can be covered for the correction, and only custom-made, like most of the custom-made orthotics, what I have seen, they're focusing only on the navicular correction. Whatever navicular drop and drift, they try to lift it as much as possible. But this is the pronation, supination, these are the triplanar movement. Okay, so with the navicular drop and drift, there's a calcaneus, there's a forefoot deviation. So we have to consider it all three aspects. What we call it is a three-dimensional correction has to be considered in it. Overall, whatever this bio-advanced prefabricated orthotics, their life is 1 to 2 years, depend upon the patient's lifestyle and body weight also. The custom made has a life of 6 months or 1 year also. Okay, so this was just an overview about how this practice works, what kind of cases you can see. Now to learn in more detail about it, okay, we in general conduct the workshop for the physio, which is a 2 days workshop, okay, which will involve very detail of the biomechanics, okay. You will consider, you will learn all like, complicated foot structure, how is the mechanics, how is the pathomechanics. You will learn about the gait cycle, muscle work, and there will be practicals about how to the gait analysis done. You'll be considering conditions in a lot detail. The assessment, again, the theory, practicals. So there will be lots of practicals which will involve the static and dynamic assessment also. There will be demonstrations also. Then there will be a brief introduction about the orthotics, and there will be practicals that how you will customize the orthotics. And in the end, there will be case studies also. So suppose if you'll get a patient with the heel pain or flat feet, then how you will start with the assessment, how you will come to the conclusion, what insoles to give it to the patient or prescribe, how that insole you will customize it. So those starters type of the case studies and practical will be there in the workshop. It will be the 2 full days workshop with lots of theory and the practicals. Okay, so now if you have any query, I have made a very short PowerPoint, so you'll have a more time to discuss whatever queries if anyone has. Lots of people has joined later actually after starting the PPT. So if you have any queries, you can put it in your chat box. We'll just summarize it everything, okay? And yeah, there is one query. We'll just finish the last 2 slides also, and then we'll answer all the queries. Okay. So the foot play a vital role in our mobility. If any minor problem in the foot can affect our entire posture, the base of our body. So it can affect the balance, it can affect the foot, ankle, and the back pain. So lots of patients with recurring back pain issue and all, you can get it deal with. If the foot problem associated with diabetes, then it can be fatal. The solution is very simple actually. Even it doesn't matter if you start practicing podiatry at your clinic or not, but at least you will have a place that you can guide your patients very well that where he should visit, okay, and what kind of correction she will need it. And then when the orthotic correction is needed, and then you can include your therapy program also, you will get a really good result. Okay, so there is one query. What is the cost per patient if you plan to correction of the foot? Okay, yeah. So as like we are including it in our, this is a kind of a super specialty practice you'll be including it, right? Now, first is that there is a consultation cost. Okay, now that depend on the therapist, how much you want to charge for the consultation. Like at our clinic, I charge 1,500 for my assessment. The entire assessment takes around 1 hour. Okay, so that is the consultation. The basic insole price is 5,000 rupees. Okay, and 5,000 rupees, and plus if there's any add-on correction is needed, that is charged, as I mentioned about the add-on patches. The patches are 300 per piece roughly, we charge it to the patient. So you can say the 5 to 6,000 of the amount the patient will have to spend. Can we use it for adult CP patient with the flat foot? Yes. The CP cases, there is only one thing: if the patient is using AFO, okay, then accordingly you'll have to modify. Even like at a time I have done that, I have put the insoles under the AFO and the good correction be done. Or some CP patient, maybe with the therapy, their ankle control is better and they don't need actually AFO. So in those cases, proper shoes with the insoles can give a good result. So yes, it can be given in the CP patient, but you will have to judge it with AF or without AFO. That is our discretion. So Dr. Garima, what can we do for chronic plantar fasciitis patient? I guess Dr. Garima, you have joined really late. So we have studied the plantar fasciitis case also. So I have discussed a 4-point screening. If a patient is already flat-footed or there are some other alignment issue, correcting that alignment is important. Okay, so usually outside, say silicone heel cups or silicone arch support. So lots of over-the-counter product patient use, or even lots of physios also prescribe. Okay, आपको heel pain है तो you use that silicone heel cup and all, but that really doesn't work at all. Okay, so what we need is we have to support the patient's plantar fascia. Okay, so what is happening is when the person is standing, when the person get up, they take the first steps in the morning, the arch collapses or the plantar fascia, gets stretched, they get a pain. So main thing is when the patient is taking that first step, we have to support the arch. Okay, so there are open footwears which has an inbuilt orthotic correction. Okay, that can be given for the home wear. And for the outdoor, we have to guide patient about proper sports shoes, and then we have to put a corrective insoles in that. So when actually their plantar fascia is supported throughout, okay, that is when the strain on the plantar fascia will start reducing, and then you will start getting the pain relief. The silicone heel cup, the problem is it is like you are putting the heel raise on the both sides. So I have got even many patients who they had a plantar fasciitis or heel pain in the past. They used a heel cup. Okay, heel pain is gone. Now what has happened is there's a lots of pressure on the forefoot. And eventually after a year, they started developing pain of the metatarsalgia. Okay, so that is why we have to prescribe orthotics which will give which will support the entire arch properly. So that can be done with the plantar fasciitis cases. Our first case study. How much PT need to spend to start this? How much PT need to spend? Okay. Yeah, that's good question. So 1 second, I've just written the calculation. So actually it's mainly a workshop where you'll learn more about detail about the assessment. The workshop cost will be around 6 to 7,000 rupees. I will not take it as an investment because that is just for the knowledge what you will do. Now the basic investment is actually nothing. Okay, the foot scale, the foot measurement scale, which is again priced as around 6 or 7,000 rupees also, but that is not something you will have to really spend on it. The basic insole cost is a 5,000 rupees. So just for the beginning, at least to show the patient what kind of correction you're going to offer, you can keep a 1 or 2 pair of the insoles with you. We will guide you about what size insole, what density insole we should keep. So that is actually something you are going to prescribe it to the patient. So again, patient is going to pay you for that. Okay, so it's roughly 5,000, maybe 10-15,000 also, including if you'll use the 2 insoles and 1 foot scale also, if you'll keep it with you to begin with the practice, that is more than enough. And basically this Bio Advanced Orthotics, the company, they share about 20 to 25% the product price margin with the physios. So for example, 1 insole cost is 5,000 rupees. If that is you are given it to the patient, so roughly about 1,200, 1,250 rupees you will get with your profit with the insoles. So whatever assessment, say for example 1,000 rupees, one patient with the foot problem you have assessed, you will get say assessment fee 1,000 rupees, and plus if you are given 1 pair of insole, you will get an add-on 1250 rupees. So say maybe in 1 hour you will earn like 2000 or 2050 rupees also. That's something which is very minimum. You have shoes also. Yeah, we have few shoes. Okay, now where we advise our shoes is when the patient foot is really deformed, or patient has very broad and extra wide width, and the outside they will not get a properly wide width broad width shoes. In those cases only we advise those shoes. But most of the cases when the patient foot is irregular, we advise their regular Asics or Nike shoes also. We will measure the foot length, width, will so then we can give a patient prescription. Okay, this is your foot size, say US 9 and 10. Uh, this type of shoes of Asics or Nike, you can buy it. Investment measuring tape can help to replace a Brannock device. Yeah, so there is one thing, Brannock device, the foot measurement scale, what we said. Okay, so lots of physio. Who's entering in waiting room? So the physios who has attended our workshop before, uh, they have started initially with absolutely zero investment. Okay, so whatever existing patient has visited them, they have assessed. Now, thanks to the technology, what they do is they take the patient's video walking, they take the patient's foot photographs, they measure their foot length and width in centimeter, and they send us on the WhatsApp. So after seeing the patient's gait and all, then we advise them, okay, the patient will need this type of insole, and considering the length, this size of shoes patient should buy, and this type of insole will be required, and then we courier them the insole. So this is something which is absolutely zero investment. Once the physio start getting regular patients, and then they maybe after 2 months or 3 months, then they call for finally Brannock device or foot measurement scale, because then it becomes very easy for them also that on the spot they will measure the patient's foot length and advise about the shoes. Many physios start even eventually later. We have one physio who is working in a Holy Family Hospital, Holy Spirit Hospital. She's still managing without the foot scale. So as mentioned, she sent us video, she sent us the measurement, and then we we advise her what is needed, and then we send the info. So she is still managing it without any sort of investment. What is the next step to start? Yes. So the first step to start is the workshop, of course, because you see that considering the cost of the insole 5,000. So when you are advising that 5,000 rupees cost of the product to the patient, you need to be 100% sure that this is going to solve their problem, whatever heel pain, chronic back pain, okay, or ankle pain they have. And for that, you need to be really thorough with your assessment. Okay, so that is why the workshop is must, where we'll teach you that entire assessment properly. You do your biomechanical analysis and you correlate with your patient's existing symptoms, and then you advise the products, and with your analysis only patient will have a complete faith on you. Okay, patient doctor has analyzed my problem so well, then definitely this is something going to work for me. Okay, so the first and foremost thing is the workshop. What is fee and the date of workshop? So workshop is going to be 2 day, 2 full days course, Saturday, Sunday. Okay, we have not finalized a date. Okay, there is a contact number mentioned on the slide. Okay, you can note down both the mobile numbers. And of course, if we'll have your data, we'll get in touch with you as soon as we finalize the date. Because of this pandemic situation, we are not giving you a complete date also. I guess lots of people has already started with conducting workshops. So soon we'll finalize the date, and fees will be around 6 to 7,000. With the dates announcement, we'll be announcing the fees also. Yeah. Any other query? So people who are attending, if any of them, they are out of the Bombay and considering it's a pandemic, you won't be able to travel, we'll be conducting the workshop online as well. And about the practicals and all, we'll try to take all precautions, how we'll be able to deliver everything properly, the practical sort also, the videos and all that we are working on. So particularly if you're outstation and you're not able to attend the direct physical workshop, we'll be doing it online also. So anyone else has any other queries? So Dr. Zaid, he's from Aurangabad and he's dealing with lots of special kids and all. So particularly in special kids, the food complications are very common and they're complicated also because there are lots of neurological involvement also. With the prescription of proper insoles and all, you can do a lot in restoring those kids' mobility also. Apart from the CP, ADHD and all other kids, they have lots of muscle tone issues also. So most of these kids also, they have flat feet. Kids with the autism also. Like at our clinic also, we have a occupational therapy. So whatever autistic and ADHD kids we get, they have in general hypotonia, which leads to flat feet. So in most of the cases, we prescribe a corrective on source in them also. In many kids with the flat feet, it is also associated with the leg length discrepancy also. So it is very good at young age when the kid is 6 year, 8 year or 10 year, when we diagnose their flat feet and plus leg length discrepancy. When we do this correction at early age, we can prevent lots of complications like scoliosis and all at the later stage which can develop. So the screen has a contact number, save that. So we'll update you on about the workshop and the fee structure will be maybe variable for the direct physical workshop, actual workshop and the virtual workshop. So we are still working on that, depend upon, how is this pandemic changes. Anyone else? How many of them they are from Mumbai and have their own clinic? I guess Nikita has Dr. Nikita has the clinic. So you have any query? Because I said I absorb the need for the kids. Yes, yes. Kids definitely, because in general, otherwise also, this number of food complications or incidence of flat feet are increasing. So in general, if you go to even any regular school and observe their kids evaluate, there will lots of population coming with the flat feet issue. So the kids, it is definitely, and when you do this orthotic correction at early age, you will get really good results because their age is growing and the deformities are not developed. So this correction at early age can prevent lots of complication. You will see really a good change in their walking pattern, and like in very short span of time, their walking pattern will improve with the correction. Of course, with your including your therapy also. Okay, I think
I think that will be all. Mm,
yes, I think the all queries are done. Yeah. So
Yeah.
we should close.
Yeah, definitely, ma'am. You can, you can write your email ID in the chat box if anyone has any further
Right.
doubts or queries.
Yeah, sure, sure.
So, they can straight away email you.
Yes, yes, yes. Sure, sure, sure. I'll just share my email address.
Ma'am has put her email ID in the chat box by the name vcarerehab@yahoo.in. You can straight away email your queries to her.
Yeah, I'm putting a mobile number also again, so you can
Your
say.
mobile number is visible, ma'am.
Yeah, it's visible, right? So you can even WhatsApp. So even the people who attend the workshop, post workshop also, as I mentioned, lots of practitioners, they are still in touch with us with the WhatsApp. And if they get any complicated cases or they are not able to decide about what correction a patient should get, they send videos and all, and then we guide them. So the even post workshop, there will be ongoing support you will get about the correction and everything. Okay. So you got the email
Yes,
address.
ma'am.
Uh,
Yeah. Yeah. This was such a wonderful session. I hope everybody loved it.
yeah, I hope everyone it was interesting for everyone. So in our workshop, that all everything will be in. It was just a kind of only trailer of our workshop, and the workshop will involve lots of detailed study about the biomechanics gate. It will be completely brainstorming and lots of practicals and case studies. Case studies we don't actually need actually patient to see, because as mentioned, even lots of physios have problems with the flat feet and blah 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 blah. So you will get actually physio will be your patient where you can evaluate, you can diagnose, and you can plan the orthotic correction. So the workshop will have a lots of practicals, and even in our PowerPoint case studies, there will be lots of videos, patients videos and all will be there. Okay, so you can get in touch with us if you are interested in the workshop. Either just send the WhatsApp your name and that you're interested in the workshop, and your location, whether you're in Mumbai or outside Mumbai, or you can put email also. So as soon as we will finalize the date and timings, every date and venue basically, we'll update you. Okay.
Thank you, ma'am. I think that will be all.
Yes. Okay then. Thanks everyone for joining. Okay. Uh,
Pleasure having you, ma'am.
yeah. Okay. Chalo. Then bye bye.